Are you starting weekly paclitaxel and worried about what it might mean for your hair? That's one of the most common questions we hear, and it's completely understandable. Before we get into it, just a quick note. This video provides general information only and is not a substitute for medical advice. Always follow the guidance from your own oncology team as they know your individual situation best. So, hair loss, it's one of the most visible and emotionally difficult parts of chemotherapy, and knowing what to expect can really help you feel more prepared. Paclitaxel, sometimes known by the brand name Taxol, is a chemotherapy used across the NHS to treat breast, ovarian, lung, and other cancers. It works by targeting rapidly dividing cells, and hair follicles are among the most rapidly dividing structures in the body. That's why hair loss is such a common side effect. It's officially classified as very common, meaning it affects more than 1 in 10 patients. Now, there are different ways paclitaxel can be given. The traditional approach uses higher doses every 3 weeks. A weekly schedule uses smaller amounts delivered more frequently, which means the peak levels of the drug in your bloodstream are lower. This is thought to mean that hair loss may be more gradual and sometimes less severe in some people. Though it's important to be honest here, complete hair loss can still happen. Everyone responds differently, and there are no guarantees. It's also worth knowing that the evidence directly comparing hair loss between these two schedules is limited, so your oncology team is best placed to talk you through what to expect for your specific plan. In terms of timing, hair thinning with weekly paclitaxel typically begins within 2 to 4 weeks of starting treatment. For many people, it happens gradually rather than all at once, though that experience really does vary from person to person. The good news is that hair usually grows back. Regrowth typically starts around 4 to 6 weeks after completing treatment, with full regrowth taking anywhere from 6 to 12 months. Hair sometimes comes back with a slightly different texture or curl at first. This is common and usually temporary. One thing worth being aware of: a small number of patients experience what's called persistent chemotherapy-induced alopecia, where hair doesn't regrow as expected after treatment ends. This is rare, but it is a recognized complication of taxane chemotherapy. If you finish treatment and haven't seen any regrowth after a few months, do go back to your oncology team for a review. So what can you actually do? The most evidence-based option available on the NHS is scalp cooling. This involves wearing a specially designed cooling cap around your chemotherapy sessions as directed by your team. It works by reducing blood flow to the hair follicles, which may limit how much drug reaches them. Scalp cooling is available at many NHS cancer centres, though not universally, so it's worth asking your team early on whether it's suitable and available for you. Your oncology team or clinical nurse specialist can also connect you with practical support, including information about NHS wig services, which may be available free of charge depending on your circumstances. Many people find it helpful to speak to a specialist nurse or a support group before hair loss begins so they feel prepared. If you notice anything that concerns you during treatment, including unexpected or severe changes to your scalp or hair loss that feels more significant than expected, please contact your oncology team or your 24-hour chemotherapy helpline straight away. To recap, weekly paclitaxel commonly causes hair loss, though the pattern may be more gradual than with 3 weekly dosing. Scalp cooling is the most evidence-based option for reducing hair loss and is available at many NHS centres. And hair regrowth usually begins a few weeks after treatment ends, though it can take up to a year for full regrowth. If you found this helpful, please give it a like and subscribe to the Bolt Pharmacy channel. And if you have a question you'd like us to cover, leave it in the comments below. We read every single one.